To this now, nursing organisation Denosa has welcomed the judgment by the High Court in Pretoria, Gauteng, that has set aside an urgent application by Limpopo Health MEC Phophi Ramathuba to stop the Health Professions Council from proceeding with a misconduct inquiry against her. This is for her remarks to a foreign national who was a patient in a hospital last year. In a video that was widely circulated on social media, Ramathuba was filmed confronting a female Zimbabwean national at a Bela Bela hospital, telling her that her country must take responsibility for the health bill. Both the Health Department and the HPCSA declined to comment on the High Court ruling. Now let's get a reaction. We are now joined via Zoom by Lisiba Monyaki from Denosa, Denosa's Limpopo Provincial Chairperson. Thank you so much for your time this afternoon. Just talk to us about why Denosa is welcoming, this ruling. We know, of course, that at the time Dr. Ramathuba's comments polarized South Africa, many saying that they were xenophobic statements that she had uttered.
Thank you very much for you and the viewers at home. Look, initially, we couldn't have reached this stage of the court rulings because initially we were the first people to note that there was a miscalculation there by the MEC. That's why we wanted to apologize or retract that statement immediately, because it was very clear to us that it has got some ethical dilemmas, especially professionally so. So the ruling, we saw it coming because the statutory body couldn't have allowed or left that matter alone as it was. We saw it as a very miscalculated move.
Of course, there's a lot of talk around just, the stance and the situation that is happening on the ground in as far as healthcare facilities are concerned, with many saying that there's still enlarging, inequality. So a person like Dr. Ramathuba's, stature needs to, as you say, lead by example. What are your thoughts then as Denosa to widen that scope, to continue as a country to, create services that are free for all?
Look, maybe we should put it clear. What the MEC was crying about, she was correct because we are overwhelmed. But the problem was the area at which she was complaining at. It is not in dispute that the province is overwhelmed. We have got shortage of staff. Our infrastructure is not that good. So it's time and again you'll hear our province complaining about shortage of medicine, shortage of staff. But that discussion should have been taken somewhere else, not at that very same platform, because the MEC is a political head. She should have known better to who to engage, and maybe not that patient. That is where she would have got help. But the poor patient couldn't have assisted her with anything, because once a person enters our facilities, the nationality or the gender or anything around that person changes. That person becomes neutral, will be viewed as a patient, and that's where our ethical conduct as managed and regulated by our statutory body will say. So that's why we saw it as a miscalculated move, but we are still saying she can still engage at other platforms, maybe through the Department of Foreign Affairs, international relations. That is where that discussion should be taken. Economic affairs, because really, yes, if the economy, if the budget is not well utilized, a small budget is given to assist a huge volume of people, that will render the department or the province not providing quality health care, not knowing very well that there are some patients who are not being accounted for. But the discussion, and she couldn't run away with that discussion, because she was discharging that discussion as a doctor, as an MEC of health And there is no way that she could have separated her political statement from herself as a medical doctor.
You know, just talking about political statements, and as we continue to discuss just the structural problems that we are currently seeing at healthcare facilities, you know, many are saying, of course, that the looming election season has seen politicians, you know, work all angles to blame illegal foreigners for, you know, South Africans' ills and woes. Are you not worried then about the possible spillover effect, particularly as these structural problems, you know, continue to be ignored?
No, you see, especially ourselves, Denosa, we might not confine ourselves or even go into the space of politicizing this part of a discussion, because we were just worried about the very same poor patient that 24 hours has been taken care of us as nurses, because those statements will have effect on that patient, and that effect will be felt by nurses, because if maybe that patient came with a particular physical condition, that type of engagement with the MEC will of course another psychological problem that now will have nurses to go even extra mile for that patient to recover. So politically, yes, there is a space for political engagement. For anything that is outside that patient's scope, it can be engaged. But once we talk about the patient, that is where our self-help nurses will advocate for that very same patient. But when it comes to structural issues, we'll also advocate if ever our patients or our nurses are rendered to work in an environment that is not conducive. That is why we'll hear us talking. If ever it will affect the welfare of our patient or the welfare of our workers, in particular our nurses. Because, if, for example, if we've got many patients and few nurses, we will complain as Denosa, because our nurses will be overburdened. Because our nurses' conduct will be questioned, our nursing care will be questioned, litigations will be directed to nurses, because they are the ones that are seen with patients almost 24 hours around the clock. That is where we will hear us talking loud. But if ever it was not affecting those two spheres that I'm trying to talk on, we couldn't even hear Denosa talking about these issues.
Lisiba, thank you so much for your time. Really do appreciate you coming through. Lisiba Munyaki is Denosa's Limpopo provincial chairperson there.